Coffee with Coker is a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
Welcome to another episode of Coffee with Coker. My name is Mark Reiboldt, and I'm the host. And for today's episode, we have a very timely discussion, and we're talking about, it's actually a follow-up episode in response to an episode we did back at the end of 2019. But today we're talking about digital transformation in action. And on the first episode on this topic, we covered digital transformation in a very kind of broad context. Big picture perspective, what's going on out there, what some of the discussion in the marketplace has been around the topic. But what we want to do is follow up on that and start diving into some real world examples of where we are actually seeing digital transformation take place in a healthcare delivery setting. And that's what we do today. So we have back on Jeffery Daigrepont and Andy Sobczyk, both Coker veterans here, and a new guest, his name is Jeff Kline, is joining us as well. Jeff Kline is CEO and founder of a company called HanGenix, and we'll make sure their information is available in the show notes. But this is extremely timing because what HanGenix does is develop for hospitals, practices, any sort of healthcare delivery facility with solutions around hand hygiene. And as we're recording this, we're in the midst of the coronavirus pandemic. We're actually having to record this remotely because everyone's working remotely right now. And so as we think about all of the way, the almost crazy evolution of the coronavirus and how it's impacting not only just regular people, but specifically the healthcare industry is remarkable. And we talk about that here. Jeff and HanGenix, their solutions, it's not something that addresses specifically coronavirus. It is something that addresses a very significant problem that has always existed and continues to exist within the healthcare world, which is infection or other issues that result from the lack of the highest level of quality hygiene. And it seems like something that would be kind of obvious that should be addressed in a hospital setting, but unfortunately it's just not. And there aren't a lot of great solutions out there that can help improve the compliance around specifically hand hygiene in the hospital setting or the healthcare setting. So again, it was very timely. I like Jeff and what they're doing at HanGenix because, and by the way, Coker has no connection to them other than that we just run in the same circles, I guess. But I've been following Jeff and what he's been doing there for a number of years now, and I've really liked it because it touches on something where there's a very significant and pointed need in the industry. And it's also something that it's not just another technology solution, if you will. It's something I like because there's true value, there's tangible value associated with it, both from a clinical quality standpoint, which is the most important, but also from a financial perspective. And that's something that is becoming more and more relevant in the world of healthcare delivery. So again, a great discussion, very timely. We wanted to have something that would tie digital transformation to what we're seeing out there in the world today. And I couldn't think of a better example than this year. So with that, we will jump into the discussion with Jeff Kline and Jeffery Daigrepont and Andy Sobczyk on digital transformation in action. Enjoy. All right, well, welcome back to another episode of Coffee with Coker. And as we mentioned in the intro, we are talking with a couple of recurring guests and a new guest. And so I'm glad that we're able to bring back Jeffery Daigrepont and Andy Sobczyk, both two of our senior leaders here at Coker. And also a new guest, Jeff Kline, is joining us for the first time. And we wanted Jeff to speak to a lot of the things that he does, that his company does, going on out there in the world, in the healthcare world, globally, in the U.S. This is, as we mentioned in the intro, a kind of our second episode, follow-up episode, if you will, talking about digital transformation. And we teed this up a little while back, and now we wanted to kind of continue the discussion around digital transformation and kind of see what it looks like in action at the ground level, kind of go beyond the theoretical perspective on this very broad topic, if you will, and start to dig into what we're seeing out there in the marketplace that is happening as far as digital transformation in action. So that's what we're going to do. So welcome, guys. And as we start off, Jeff, Kline, if you don't mind, I'm gonna let you kind of introduce yourself. Becker's had a article, and we'll make sure a link is available in the show notes of the episode recently that it was titled 15 Things Health Systems Do Today That Will Become Obsolete Due to Technology. And number 10 on that list, I believe, is ignore hand hygiene mistakes. And so I don't think there's a better way to tee up what Jeff, you and your company does than looking at something like that. So maybe just give us the 2-minute spiel of what you're doing and kind of some of the things you're seeing out there in your work.
Well, I think the topic is timely, right? I mean, with all the headlines right now going on with the coronavirus, I think hand washing is probably the number one recommendation you're hearing from all the experts that are out there right now. What's interesting is I believe this article was published prior to the outbreak and all the news stories, and our message has not changed. We still are seeing over 500,000 people are dying from infections every year. That's, combined hospital and non-hospital healthcare facilities. 500,000 people dying every year from infections. And poor hand washing is the number one cause of these infections. So in essence, our message hasn't changed right now. I mean, it is still the same message that we've been delivering, but I think there's an acute awareness right now in the public how important hand washing is right now. And, the biggest challenge that hospitals have and other healthcare facilities is that these systems have no effective way of actually monitoring who's washing their hands when they're supposed to. So the current practice right now is what's called the secret shopper or a manual observer. So somebody within the staff, usually somebody in infection prevention, but it's starting to be more folks as a part of their obligations and their shift is to manually observe their colleagues as they enter and exit the patient's room to make a determination, did they wash their hands when they're supposed to? And this has been the gold standard for decades right now. And there is a real groundswell of understanding that this is just a flawed process right now. There's just a number of reasons why that doesn't work. Number one, they are standing outside of the patient's room and watching people entering and exiting to determine if they wash. There's a number of studies out there that show that 80% or more of the hand washing opportunities take place inside the patient's room. So standing outside of the room misses a significant number of the hand washing opportunities. Number two is they take a very, very small sampling of those opportunities. So from our estimates, less than 0.5% of the hand washing opportunities are captured using this methodology. This concept of a secret shopper kind of goes away because most people know who the secret shopper is. So there's a Hawthorne effect. So the results get skewed higher than what they actually are. And there's no specificity to the data. So at the end of the day, a number gets rolled up to management that says we're 90% compliant, but there's no information to follow that tells them more about who, when, and where hands aren't being washed within the hospital. So this has been a challenge for a long time. We've been starting to see a lot of things changing within the industry. There's a number of third-party organizations that are involved in quality ratings within the healthcare system, whether it's Joint Commission that is now going to cite a hospital or an individual if they find during their audits if just one individual doesn't wash their hands when they're supposed to, that person and that hospital gets a citation. Leapfrog is another quality rating organization. So they have now added to their annual survey where they were directly asking hospitals if they're using electronic monitoring to track hand washing in the hospitals. And if the answer is yes, they can potentially get a quality higher score. And very recently, within the past couple of weeks, we've seen CMS, Medicare and Medicaid folks questioning whether Joint Commission can effectively monitor some of the quality metrics that they're doing because, number one, there's human error involved. And with Joint Commission, there's actually an arm of Joint Commission that does consulting services for the hospital. So is there a perceived conflict of interest? So they directly asked, is there a way that we can begin to automate the process of capturing quality data so human intervention doesn't need to take place at all? So we're seeing a lot of things that are happening. Now you add the COVID-19 virus, and there's just a ton of visibility about the importance of hand washing right now.
Yeah, I'm glad you mentioned it because we are recording, as we're recording this, we're kind of in the depths of the coronavirus or COVID-19 pandemic, I guess, and working through that. And so it is timely. I think it's timely that we're talking about this period, because prior to coronavirus, this was still a major issue, and specifically within the healthcare services realm. So, and I think it's also very interesting to see something that where you think about digital transformation applying to something that is very, very relevant, not just coronavirus, but there's still a high acuity level here as far as the relevance and the impact of something like this goes. If you don't mind, just give me the brief description of what you all do that is kind of looking to address this and hopefully kind of create a better alternative.
So I'll talk about the technology, and then I'll kind of segue into kind of what the overall goal is and what's involved in an entire project, because, you know, the topic is digital transformation, and those are two words, right? So there's digital, which is kind of the use of data or automation, but then there's the transformation piece, right? How do we change the way work is done, or how do we change human behavior as a result of all this new information we're able to ascertain? So part of our solution is the technological solution. So we have a few components that get installed within the patient's room right now. And we're primarily focused on inpatient hospitals, but this technology has, and as we describe it, you'll recognize the number of applications goes beyond hospitals, goes beyond hand washing, goes beyond healthcare. When you look at all of the other industries that are concerned about hand washing, whether it's cruise ships, right, hospitality, food service, but particularly in healthcare, it's a significant challenge. So we install in the patient's room a sensor that goes behind the patient's bed. And what's unique about our technologies, we actually use ultrasound or sonar technology, which is the same technology that's used for self-driving cars, or it's probably on your car right now. When you back up and you get close to something and it beeps, that's the same kind of sonar technology. So we are able to create what we call a patient protection zone using ultrasound. So it's unique, whereas something like RF or Wi-Fi or Bluetooth, those signals all go through walls and are very difficult to contain. The use of ultrasound creates this very discrete zone around the patient's bed. At all the soap or gel dispensers, we put a small chip in there that's triggered when the healthcare worker washes their hands. And then they will wear a small, lightweight badge that we've made a version out that will integrate with their existing hospital ID badge. That badge is what tracks all of their hand washing activity. So when the healthcare worker washes their hands, they basically get a time-based token on their badge that says your hands are clean for the next 30 seconds or 45 seconds. And then as the healthcare worker approaches the patient and enters that zone, if they haven't washed, it scans their badge, and if the token's expired or they didn't wash at all, the badge will chirp and give them a reminder and say, hey, you've got to wash your hands for the first time or wash again. And then the same thing when they leave that patient area after a certain amount of time, they're expected to wash, and they'll get another reminder if they don't. What we've seen happen is the guidelines around hand washing has evolved, where it used to be just wash on your way in and out of the room, and that's good enough. And as I alluded to earlier, That's now changed. The World Health Organization came out with new guidelines several years ago called My 5 Moments of Hand Hygiene. And essentially what that's done is it's moved hand washing closer to the moment of truth or to the patient itself. And when you boil it down, the major moments are really right before and after touching the patient or touching something that's within the patient's environment, meaning within reach or attached to the patient. That's when you need to make sure that your hands are clean at that point. So that's what's unique about the ultrasound. We can define that zone around the patient's bed. So after the healthcare worker has gone through the process of doing patient care in that room, once they leave the room and walk down the hallway, then at all the nursing stations, we have a data transfer device that essentially pulls the data from that person's badge and then ports it to the cloud. So now we can begin to push out reports near real time. People don't want real time data right now. For the most part, we don't expect someone to be chased down the hallway and say, you didn't wash your hands. But it's timely data. I mean, let's say at the end of the shift now, the nurse manager can get a report that says, here was your compliance rates for your staff. And here's how it's trending. And here's how it compared to last week. And then we can send more sophisticated data to infection prevention or quality or process improvements, folks that really want to dig into the data and understand, is it a certain person? Is it a certain unit? Is it a certain time of the day? Is it a certain room? Where are we having specific challenges? And they can really understand all that there is around that.
Yeah. Well, and as we know, as we're starting to see more and more, these types of metrics are tied to quality, which is tied to financial performance. So that's only going to become more of the norm. So that's very helpful to get kind of a background on what you all do. And I want to back up for a second, and I'll bring in Andy and Jeffrey as well to talk about, some of the headline examples of where we've seen kind of the digital transformation discussion go, even since our first episode talking about this just months ago. And Andy, Jeffrey, feel free to jump in on kind of what we've seen out there in the last few months.
I've been jokingly saying, the greatest technological breakthrough of the 20th century is going to be washing hands prevents the spread of diseases. So, so if you look at it like that, it's kind of great if there's a silver lining that we are bringing attention to something that's so basic that can save so many people's lives. And so, I guess if you try to find something positive, hopefully this will be it. For me personally, having had some recent surgery, and I was fortunate enough that I was able to opt to have it done outpatient, because candidly, the greatest fear I have about a hospital is going in as a healthy person and never coming out. Just because you get caught with get sepsis, you get caught with a bacteria infection or something catastrophic like that. And so for me, this is not only refreshing, it's long overdue. What I've seen from the technological side of things, where I spend most of my time, which is on the EHR systems, the analytics side, the aggregation of data and whatnot, the focus up to this point has been, how do we prevent sepsis? And they've been largely looking at early indicators so they can have early intervention, because by the time a person shows up that's being sepsis, it's oftentimes way too late. And it was always baffling to me why we didn't go to the root cause, which is the hand washing. And again, not to oversimplify it, but even things like I've been told, that Jeff, maybe you can verify this, that even things like the doctor's necktie or their cell phones, they wash their hands, but then they touch their cell phones. So just all those sort of little things that you have to change the thinking, the human behavior. And even with the best training and the best intentions, in fact, if you saw the news report, I think it was one of the representatives from the CDC was lecturing the country on not to touch your face, and then she licks her finger and changes the pages. I mean, literally in real time. I mean, you just can't make that up. And so it's hard to remind people. And a beep is good. I mean, look, I literally forgot how to back up my car the other day because I was in a rental car and it didn't have the backup camera. It didn't have a little beeping sensor. Some cars even buzz you in the seat whenever you're about to hit something, or the steering wheel will now buzz if you're drifting off the lane. So as good as we think we are, and as much aware we are, and if you get the person from the CDC licking their fingers on live TV, then that just tells you that the best of training isn't going to do it. You need intervention, artificial intelligence, the reminders. It doesn't take the place of a common sense, but it also is helpful in that sense. So I'm excited about it and think it's long overdue.
Yeah. Andy, did you have a comment?
I think, from the first podcast we did on this topic back in November, I was just kind of looking out at some of these email blasts and news, stories that just kind of pop up in my inbox. And it seemed like there were several, right around that time and even into the beginning of this year about really big health systems launching these digital data efforts or, digital platform efforts. You saw Mayo Clinic launching their own digital business, trying to have a Mayo Clinic platform. Partners Healthcare announced a $100 million initiative, centered around AI innovations and digital transformation. You see, Mount Sinai in New York launching a $15 million digital health center focused on AI. Their School of Medicine, a $100 million research center focused on AI and precision medicine. And there's a lot of buzz, I guess, in the industry around these topics. Much of it is kind of hype around what, AI and digital transformation can do to clinical decision making. But I think what we're seeing right now that's actually, in the works and more practical is around administrative tasks or being better around collecting our data or, focusing on things that are more, kind of smaller, I guess, or smaller in scope than some of these larger efforts. And so I thought, having Jeff here, it's a great opportunity to talk through, what does this transformation look like, when you're working on a project that takes a new technology to solve a problem that you previously had. Obviously, as consultants, we work with clients a lot on making changes, whether it's process change or changing a comp plan or whatever else it may be. And there's a whole kind of continuum of, the change management spectrum where at first there's doubt and concern around what the new process is going to look like or how it's going to impact people all the way through to where there's acceptance and, actually making the progress that we hope to make. And I thought, with Jeff being here, we could focus on one practical example as opposed to talking about, AI and how it's going to change the world and those kind of things. I mean, those are great topics and we can probably hit that in another podcast. But for today, I thought, Jeff, maybe kind of walk us through what happens if somebody decides to adopt, HanGenix and wants to implement it in their organization. What does that process look like? And maybe we can kind of, dig into some of the details there and extract some things for the listeners to take home and say, okay, well, even if I'm not making a decision to do something like this in my organization, maybe there are some things I can, prepare for as I, wrap my head around these changes that are, inevitably coming for pretty much every system.
Well, thanks for that question. So that segues right into the second part when we talked about the digital transformation. So you're right. At the end of the day, this is about changing human behavior. So, and again, we have experiences of both ends. So we have folks that thought that we are just going to install this technology and it's going to change the way that work is done. And that's not how these projects work. And anyone who's been a part of a successful transformative implementation knows that it's a holistic project. And, first of all, it has to start with a commitment from senior management. So that's the first thing that we look for. Is there a group of senior managers that, number one, recognize that they have a problem? Number two, they recognize that technology can be an assistance in order to change that. And number three, are they willing to make the investment both in time and money to address that problem? But you also have to have buy-in from the staff. So at the end of the day, the folks that are on the front lines that are going to be wearing the badges, that are going to be responding to these reminders to wash their hands, they have to understand what it is that's happening and how this data is going to be used. So communication is key, and it's got to be in both directions. So when we talk about how the data is going to be used, there's a couple of approaches, and we are huge proponents of positive use of data. So, they could use this data as a hammer, right? So let's penalize people for poor performance. There's a ton of psychology studies out there that just show that that's not effective. We are much more of a proponent of how can you put in positive incentives in place? How can you reward people? And by the way, financial rewards usually aren't the best, because once you give somebody a financial reward, that becomes the new expectation. So when it goes away, they feel like they're getting a pay cut. So it's other kinds of recognitions. How can you socialize if somebody's done a good job, or recognize them among their peers? Is it a periodic Starbucks gift card to the unit that has the best performance, et cetera? But this data can also be used as a training tool. How can we develop best practices and share that information among our peers and then to the broader healthcare community? And then how can we look at it from a process improvement opportunity? Maybe the way we're going about caring for the patient could be more effective in a number of ways. Do we have to have somebody going in and out of a room 8 times in the course of 10 minutes? Maybe if we stage the work differently, we not only make the folks more effective, but we would reduce the opportunity for contamination by minimizing that in and out of the room for the most part. And oh, by the way, this technology is designed to protect the healthcare worker as well. It's not just protecting the patient. Especially now with the coronavirus, people are realizing the healthcare workers have to be protected as well. So we find successful projects are when there's a cross-functional team that's involved. So obviously senior management, infection prevention, nursing, and the chief medical officer need to be involved, quality, somebody from facilities, because, we are installing technology in a room, so facilities need to be involved, and then somebody from IT, because we are transmitting data to the cloud. So at the end of the day, IT needs to be involved, although we are able to transmit data using broadband that can avoid going through the hospital network. But they need a project manager as well. So somebody whose focus is managing this, because this is a significant project. It can be small in scope. We often recommend kind of a crawl, walk, run approach. So let's just start with 1 or 2 units, and let's make sure we train everybody. So education is a must with this. Where we've seen projects not be as successful is when the staff was not trained ahead of time. We had customers tell us that they will train after they receive the data from this technology and to give them a better idea of where training is needed. And we see it quite the opposite, where folks need to understand, number one, what's the common practice that they're moving toward? How is it going to be measured? How is that data going to be used? And why is it important at the end of the day? We ensure that that is done before we even set foot in the facility to start installing the technology. And then like good change management projects, right? You're celebrating and socializing small wins, you're recognizing good performance. So all the things that we've all traditionally been a part of, senior management buy-in, good communication, crawl, walk, run, and then celebrating or socializing small wins are all critical.
One of the things that we get asked a lot by our clients, obviously, as they begin to try to prioritize their IT projects, it sounds like to me what you were describing. Your IT footprint is very, very light. I'm assuming this does not take any exhaustive project planning or any significant resources in terms of internally. Sometimes that's the reluctancy to do projects like this. There's always the concern about, do I have the resources? But what you were describing, it sounds like it's pretty non-invasive as it relates to the implementation. Is there, you didn't mention about any sort of back-end tracking or database. Can you see your users? Can you see the badges when they're moving, where they've crisscrossed? If there was an incident, could you maybe use this technology to perhaps provide evidence of the hand washing, or in the case that where you might have a lawsuit, would there be benefits of having this level of data tracking?
Absolutely. So essentially what this technology is doing is, and again, we can, the primary zone is around the patient's bed, but we can create zones as small as a keyboard or as big as an entire room or larger. But what it does is it timestamps when somebody enters or exits that zone, and it validates whether they performed a protocol before or after entering or exiting that zone. So hand washing in particular is that protocol. So, one of the things I think you're alluding to is this has a forensics capability to it. So when we're talking about corona or other pathogens where there's an outbreak and you identify patient 0 or somebody who's been contaminated, you can now look backwards and say, where are all the places that this person went? Did they wash their hands or not? Who did they contact along the way? So you can really start to get a holistic view of all that.
No, I was going to say there could be other uses, such as, like, for example, you could build a zone around a pharmacy area for controlled substances, and those badges, those employees should not be in those areas, or those would be restricted areas. And then, not to completely get you off off topic, but I've seen a lot of interest in with nursing homes and geriatric type facilities where they're caring for patients with dementia to try to prevent them from leaving the campuses or leaving the care areas. So I would assume, and as you begin to think more broadly, do you see your company going into those areas, or are you strictly staying focused on the prevention of the spread of diseases?
Well, both, right? So we constantly have kind of a 3 to 5 year planning cycle where we look at other applications in other industries. But as an early stage company, focus is really important for us. So our immediate focus is in the hospitals, but there are even applications within the hospital. So another area is environmental services, right? So the people that clean their rooms, they have no visibility to what those folks do all day. So are they going to the rooms that they're supposed to? How soon after discharge do they show up? How much time are they spending in the room cleaning? Do they go into the bathroom? Do they approach the bed and clean the bed rails, et cetera? This is all brand new information for those folks that hospitals are craving right now. There's, physician face time with the patient. There's a correlation between patient satisfaction and how much time the physician spent with the patient. Easy for us to track. So there's dozens of other applications that we can track within the hospital. But you're right, as far as the nursing homes, and even, tracking hand washing in the nursing homes is a huge. So when I gave the number of 500,000, 400,000 of that are in things like nursing homes or long-term acute care or hospice, or areas where those infections can be really detrimental and nobody's really monitoring what's happening in those environments.
Can we get you to focus on the hotel rooms? That's a big, I'm just joking.
How about cruise ships? Come on.
Right. I swear they don't clean those things. Yeah, cruise ships too.
Yeah, so I think as we look at HanGenix as kind of a great example, and again, very timely, Jeffrey, I think you said it well, the fact that the only way to combat this pandemic that we're finding is stay at home, wash your hands, don't come in contact with people, basically have good hygiene and have good, cognizance of your surroundings and your impact on the environment. So when you think about something like this, it's kind of like a no-brainer to me. Like, how could we not be doing this in our hospitals? But Jeff, Kline, to your earlier point, this is something that is just kind of, it's never really been addressed, but infection rates have gone up. Hospital-acquired illnesses have remained an issue. And again, it gets back to the economic, I think that's the clinical argument there, which is the most important. But then you also have the economic argument that quality is directly being tied to financial performance and incentive, both for the hospital or the health system and for the individual practitioners, the clinicians. So I guess what's holding us back here? And, as you think about, again, most of the time we're talking about technology, we are talking about things like electronic health records and the data and the analytics. How does this tie? How does something like what you all have tie to that?
Well, if I could just add a couple of things as you're talking about the financial implications. The number of lawsuits is growing every month, it seems. Infection rates are now publicly available information. So if you're going to get your elective surgery, which is where hospitals make all their profit, are you going to go to the safer hospital or the not safer hospital for the most part? The quality ratings are being impacted, Joint Commission. It's our belief, and again, I'm biased, obviously, but I think this kind of technology will become a standard of care. I originally said within 3 to 5 years, but it may move faster now with what's going on right now. It's just a matter of time, I believe, until the CDC recommends hospitals at least consider the use of technology. And that a lot of times for different segments of technologies, it becomes a game changer when the CDC is saying, hey, I think you guys should think about it. As far as impediments, there's a number of them. So first of all, some hospitals really don't believe that they have a problem. And part of that is because they're being told they're 90% compliant in hand washing. And I can tell you they are not. There's not a single hospital that we have done an engagement where we've come in and, the first thing we do after we implement the technology is turn off the reminders and distribute the badges and just kind of disappear for a couple of weeks to try to get a baseline compliance rate. And it has never been over 50% when we've done it from a baseline. It's usually in the low 40s or high 30s for the most part. So I think a lot of management does not even realize the magnitude of the challenge they're having right now. It is a financial investment, right? So you're competing with other infection prevention type initiatives that are out there. We happen to believe that this should be the top priority, but not everybody feels the same way. So part of what we're trying to do is to raise the profile and the need. And I think as we just discussed, all these ramifications of hand washing is proven to be the number one cause of infection. We think we're going to get more of the attention from that standpoint. And then resistance to change, right? There is a big brotherly aspect to this technology. So part of what we try to do is dispel that, right? And again, this is the conversation with management is you have to talk to your staff and tell them how this data is going to be used. If people think that their pay is going to be cut because their infections, because their compliance rates are low, that becomes problematic for us. And anybody that's been in healthcare is when the nurses make a decision that they don't want your technology in the hospital, it is almost impossible to overcome that for the most part. Right. So there has to be somewhat of a what's in it for me application. And we need to work with management to help them convey that to the people that are on the front lines caring for patients.
Yeah. I think those are great points. And I think when I think about the broad term of digital transformation, I think this kind of fluffy, hard, not very tangible, hard to really conceptualize thing that people talk about, but really never comes to reality, or certainly not as expected. But I think this is really practical, and that it's not only something that puts digital transformation into action, but it's what I always look for is there has to be value tied to it. And I think you said it very well. If the clinical staff can't get on board on this, or any of the staff can't get on board, they don't support it. It's like you said, if it's going to be a disciplinary type approach, it's never going to work, and it's certainly never going to be as effective as you need it to be. So I think that says a lot about when you're going in on whether it's something like this or any digital transformation initiative, going in with the right message, well, the right purpose behind it, the right foundation as to why you're even doing this, and then the message behind it, and whether it's training, whether it's change management, whether it's business process improvement, all the things that are needed to make something like this successful. You got to have all those different components in order for this to really work the way it's supposed to. And I think that both for this and with any digital transformation, would you all agree?
Yeah, absolutely. Jeff, you mentioned the crawl, walk, run, kind of process that you sometimes have to go through with, client partners. Curious, like you mentioned, potentially piloting or kind of launching in a small unit, or, not necessarily the entire hospital. Well, what does that, kind of look like as it relates to like staff or nurses turning the corner and embracing this? Is it, like, oh, we had one unit hit 60%, or, or is there just kind of a clarifying moment for them as it relates to some of these projects?
Well, so one of the mistakes that we think that hospitals sometimes make is they pick an arbitrary goal that they say, we need to be 90% compliant by the end of 6 months. And to be honest, as we've changed or evolved the guidelines to this 5 moments approach, they used to say 90% was the magic number when it was foam in, foam out. Nobody really knows what that right number should be. At some point, there could actually be a diminishing returns, right? Where you hit 85%, and that's as good as you're going to do as far as impacting infections at that point. So to have this number that it's a failure if you don't hit that number is the wrong approach. This has got to be it has to be a continuous improvement project. It has to be ingrained in the hospital that this is a part of our normal process day in and day out. We're going to constantly look at the numbers. We're going to share best practices. And every month and every year, we're going to try to do better than we did last year. And then we're going to watch the impact of what's happened to infections over time while we're on this journey. But it's not, it shouldn't just be, here's the finish line and we get to this number and we're done. It's just got to be ingrained in a normal psyche and business process. It's like putting on your seatbelt, right? You don't even think about it anymore when you do it. But there was a time when people went through where they were kind of resistant to it, and now it's just automatic. This concept of hand washing and be reminded when you accidentally forget should just be a part of the normal process going forward for hospitals.
Yeah, that's helpful because, again, I think the misconception sometimes is that the technology, the solutions that are out there are kind of magically change things, and it's like a silver bullet type approach, and it's not. It's very much a kind of process and sometimes an iterative approach. But I think going back to Andy, your point, and Jeff mentioned earlier, kind of this crawl before you walk and run type approach makes sense. And I think it's something that's palatable too when you're thinking about if I'm a hospital, what you name it, CEO, CFO, or CNO, chief medical officer, chief nursing officer, we're going to have to kind of ease into these types of things and really validate the approach we've taken and the data we're getting back. And then you got to do something with it, which I think goes back to what can we do with this data? How is this data meaningful other than, hey, we're doing a better job at hygiene? Where, how else can this be valuable? And I think that's something very important. As we kind of wrap up here, anything else that you guys wanted to mention on this topic or anything related to it?
Yeah, I was curious, Jeff, about you mentioned there's a lot of data generated from, the software and the setup from what you guys offer. Can you kind of describe, how organizations are, adopting those analytics? I'm sure some of it is different than what they're used to, as it relates to reporting and, do you have any kind of takeaways from, what's been really useful in terms of teaching them a new way to look at, their own analytics and their own data?
Yep. So we take kind of a multi-tiered approach. We're somewhat agnostic to the tool that's being used. So there's kind of three levels. So again, we can provide very simplified reports. It's literally it can be an email, a specific data for a specific user for the folks that they're responsible for. Because not everybody wants to click through links and manipulate data. They just want to see a simple list of who did what the past shift. So we can start that basic. We also use Tableau is one of the business intelligence tools that we use. But we will work with any tool the hospital has. So we can just write an API and port the data into their existing business intelligence tool, or the hospital can in fact reach into our database and pull the data out themselves and drop it into their tools. There was a question about porting this data into the EMR system. It's absolutely feasible for us to do that. There's some thought around that. You had mentioned about, can we track, there was a lawsuit, can we track what happened within the hospital? And some of the concern around that is right now, quality data is non-discoverable in a lawsuit, or else hospitals a lot of times would not be forthcoming with reporting that information. Once the data gets ported into an individual's health record, it does become discoverable at that point. So that could be a pro or a con. And again, there's a lot of discussion around that. So there can be, now there's visibility as to, who entered and exited, who washed and didn't wash in the care of that patient. Now, you can't really prove causality that one time one person didn't wash their hands and they contacted that patient, but that was when the infection was created. But there's also a story to be said by the hospital that says, look at the investment that we made in this technology to do everything we could to minimize the risk of this patient being infected. And look at the improvement that we showed overall in compliance. for there to be an expectation that there will never be a missed hand washing opportunity is crazy. So, I think there's a preponderance of evidence that the hospital can say, look, we're doing everything we can. We got process in place. We invested in technology. We're training folks, and we're showing continuous improvement on that. So I think what we may see the rules change a little bit, where hospitals will be more proactive in importing that data into the EMR system. So we have the capability of doing that. It's the hospital's call how they want to use that info.
And Jeff, along those lines, I agree. There's no perfect system, and I even assume there's going to be those that will try to figure out if there's ways to game the system or work around it. What are some of the things? Like I know when I've have heard of this type of technology in the past, one of the earlier, when it first came out, one of the criticisms was you just flash your badge by the wash station and that's enough to clear you. Are there sensors that can detect that the water was turned on? Was it hot water that they actually hit the soap dispenser? Or is it just mostly just censoring the movement? Has it gotten to the level where you could have some better checks and balances on those individuals that might want to try to get around it?
So the technology is evolving, and I don't want to disclose too much proprietary information, but the way it works now is there's, based on whether it's a manual pump or an automated pump, the chip itself recognizes when soap has been dispensed, and the token is given to whoever the person is that's closest within a specific range of that dispenser. So they have to at least put their hand under there to dispense soap in order for them to get the trigger. Now, if somebody puts soap on their hands and then throws it into the garbage can and doesn't wash their hands, then that's hard to monitor. But, your point is valid. There are always going to be ways of trying to game the system. So, for instance, somebody could take our badge and this is one of the reasons why we integrated with the hospital ID badge, because people always have to be showing their picture ID, so it has to be worn. There is an element of this badge where it needs to be pointing outward. So if people flip the badge by design, or if they put it in their pocket per se, then it may not capture any data during that period. But we also have indications. We'll get notifications if there's extended amount of times where people were showing they were supposed to be using the badge and they weren't. We're adding an accelerometer to the badge, so we know when it's moving and it should be being used. So there's constant advances to this technology that's going to be able to provide information to the healthcare worker that, hey, this is an anomaly. We were expecting to see this, and this is what we saw. Even things like, the badge can go into a sleep mode when it's not being used. It extends the battery life of the product. That's where the accelerometer can be used. If the battery's running low, we can proactively send out reminders to folks to say, hey, you need to recharge your badge sometime this week. Things like that. Yes, there's always a way to game it if they want to, right?
Yeah, but I was going to say the one unique characteristic about this technology is it's actually not only keeping the patient safe, but it's keeping the caregiver safe. And I can't imagine a person that wouldn't be fully compliant with technology that protects them as well as their families, because then they take that home and give it to their loved ones. So, I mean, you'd almost have to be I can't even imagine a justification for trying to get around it, other than just somebody seems to think it's an annoyance, but then again, they're putting themselves at risk. So I think the likelihood of that has to be extremely low. I think it's just more of keeping it top of mind and recognizing that us as humans are not perfect, and we could definitely use reminders. We get distracted, we get sidetracked, we had good intentions to wash our hands, then we took a phone call, all those good reasons why we didn't do it. But this just helps us support that memory to do it.
Well, I agree. And there's kind of different schools of thought around the reminders. We have the abilities to do a light that flashes. There's systems that a human voice tells somebody, please wash your hands. Our thought has been, we want to be discreet. Like, we want to give the healthcare worker the benefit of the doubt and not embarrass them, especially if there was a false reading by accident. We don't want them to be embarrassed. It's just something that's subtle that only that healthcare worker is reminded themselves. But more and more hospitals are talking about, we want family and guests engaged, the patient themselves engaged in the process, and that they have the ability to remind the healthcare worker if they don't wash their hands, that if they see a red flashing light on the badge, it may prompt them. Again, we let the hospital decide how they want to remind the healthcare worker, but all those options are available for us.
Good. Well, this has been extremely helpful, Jeff. We appreciate you being willing to come on and jump into the conversation, which again is very timely in many ways. But I know we'll look forward to hearing more about what you and HanGenix is doing already. So that hopefully we'll have an opportunity to follow up and maybe continue the discussion along. But in the meantime, thank you all for contributing, and we'll look forward to continuing the discussion on digital transformation in action. Thank you, guys.
Yeah. Thanks, Mark.
Thank you very much, gentlemen.
Thank you.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback. And we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.